that's a beam of hope that you give them when they come in. The first person that they meet is very important. So we train these people as well to know how to attend to them, to receive them, and put smiles at least before they leave. They feel comfortable and they feel happy before they leave. And here we have some of our patients that came in for this conference.
At the plenary session, there was a conversation about driving excellence through a nationwide network of radiotherapy and innovation. But before we get into that, we would like to get to know what Oncoclinic is about.
Thank you so much. It's so nice to be here. So for Oncoclinics is a management company. So we equip and we manage radiotherapy centers. And radiotherapy is one of the treatment options for cancer patients. So, and this is something that before now, you have to travel out of the country to get this. But now we have that in Nigeria, and that's what Oncoclinics is all about. So we provide these services, and we have different centers. We have 3 operational centers, and by the end of next month, 2 new centers will be adding up, will be starting, and now we'll be making it 5 centers. So we have in UNTH Enugu, we have in Dufut Devumai Health of Science and Technology in Ebonyi State, and then we have in Uduts, Sokoto. The new centers coming up is in UBTH Benin and Katsina. So this is what we do, the chain of these radiotherapy centers to provide these treatment options to our patients. And for Oncoclinics, we are in partnership with the teaching hospitals. This is where the bulk load of the patients are, and we provide affordable and accessible care to our patients. So that's what we do in Oncoclinics, and we hope to do more. And yeah.
Thank you. We hope to see you do more also. Mr. Anas, please can you shed light on why driving excellence is such an important topic in the fight against cancer?
Yeah. Basically, when you talk about driving excellence through radiotherapy innovation, it's one big topic that can be dissected into 3. The human resource strengthening, which is quite a limiting factor in the cancer ecosystem. And then the second is the technology. The third one is infrastructure. Just like my able colleague Dr. Tima said, we are filling up that gap that there is. It's a very big crutch that is affecting cancer care in Nigeria and Africa generally. So what we do, the reason why we pick this topic is it's completely pictures what we do to solve these challenges cancer care is facing in Africa and Nigeria to be specific. Because like she said, we have 5 operational centers in Nigeria currently. So the human resource aspect of it, why it's very important. There is a dearth of human resource capacity in the cancer ecosystem. We don't have enough oncologists, we don't have enough medical physicists, the radiotherapy is very much to cater for the clinical needs itself. It's then moving down to the technology itself. There isn't advanced technology for managing cancer. So reason why we felt we need to fill up that space, and then we've been deploying advanced technology to existing tertiary institutions in Nigeria, then streamlining operations, making it as smooth as possible. And then investment also, like I said, in human resources. That is one aspect of us. We do local and international trainings, multidisciplinary trainings across medical oncologists, medical physicists, radiotherapists, and all. The third one is infrastructure. When you have the human resource, you have the technology, then you need an infrastructure where those things will be put in place for operations. So definitely, what we do also is we refurbish existing centers to meet up international standards. Where there are no bunkers for treatment, we build one. Where there are faulty machines, we fix them. Where there is a need for deploying new infrastructure, we all come to do that generally in Nigeria. So, and then we are hoping not just Nigeria, very soon we will be expanding our reach to African countries, specifically starting with West African countries, which is more alike with what we do in Nigeria. Yeah, so definitely that is why we chose this topic.
Thank you very much for that insight.
Can you add to that?
Oh yeah.
Yeah.
Please.
So to add to that, in terms of the driving the innovation, so in Nigeria, we know that there are not a lot of cancer centers in the country. So this is where we have these cancer centers in strategic location. So we can have like a grid whereby if something is wrong here, we can transfer to the next one, the next closest. For example, in Enugu, if there is an issue, maybe a 24 hours downtime, the patient wouldn't have to wait. We move this patient to the next available center, which is Ebonyi, just an hour away, and the patient continues their treatment. So you see that there is no break in the treatment chain. And also, in this innovation that we're doing, there's some form of awareness that we're doing monthly, quarterly, and we reach out to this patient because you'll be surprised that a lot of people don't know that they have cancer and they don't even know what cancer is. So this awareness is also a thing that we are doing to bring this sensitization to these people. And also, the best place to reach out to them is the rural areas. You meet them in those places and educate them on what this is about, the importance of early diagnosis, because you find out that most of them present late when it's already gone out of hand. So these awareness campaigns that we're having quarterly is helping us to also build the ecosystem. So we have people presenting early and they will get the necessary help that is involved as well. Then for innovation, like you had mentioned, we are more into advanced technology, and we incorporate AI into what we do. And in our process, we have an entire process before treatment. So we have this AI also part of what we are doing. So that's to tell you how advanced we are, and we are in tune with the trend, and also to get the best options for our patients in Nigeria, not just for people that could afford, but for everybody, because we are, if not the most affordable in the country right now. Our prices are quite, and we consider our patients a lot. We are more patient centered. So this is one of the things that we are putting in place, and capacity building. We're very big on training. We send our professionals outside the country, not just the clinical team, the non-clinical team as well, because first contact with the patients has a lot to do. These patients are already frustrated. There's a lot going on with them. So that's a beam of hope that you give them when they come in. The first person that they meet is very important. So we train these people as well to know how to attend to them, to receive them, and with smiles at least before they leave, they feel comfortable and they feel happy before they leave. And here we have some of our patients that came in for this conference. Yes, they are our survivors. So it is really good to have that.
Thank you very much. That's amazing. Dr. Nas, final thought. How is ARCON as a scientific conference, the scientific conference, how is it important to your work? Why is this kind of gathering important to what you do?
A gathering of Marvin like this, you quite understand it's going to be an exchange of intellect. So it's very, very vital that we can search for partners that share same goals, missions, and values as our organization to see how we can collaborate. The main aim is one, just get the care to be accessible, to be of quality, and then affordable,
Thank you
basically.
very much. We'll end this at that note. Thank you very much.